Do you have ADHD? Who knows? But the thing is, despite what it's called, attention deficit hyperactivity disorder, interestingly, there are lots of different types of inattention. So it's not just I can't pay attention. It's having a hard time focusing. It's having a hard time putting your attention on multiple things at one time. It's having a hard time switching between two simple things. It's having a hard time sustaining attention. It's having a hard time focusing in your mind to manipulate complex ideas or objects. So there are lots of different types of inattention. When you go and get a neuropsychological evaluation, we look at all different types. Obviously, there are impulsive responding, and there are two primary areas that may be occurring in. Anterior cingulate cortex, where you can't really kind of orient attentional capacity, or you might have right orbital frontal deficits in which your mood lability is kind of all over the place. People are having mood swings and things like that. That area is commonly impaired. So just because you're impulsive doesn't necessarily mean that you have ADHD. It could be a sign, but it doesn't necessarily mean it. And a good neuropsych eval is going to really kind of dig deep into that stuff, because at the end of the day, people kind of want to know themselves a little bit better. And I really don't like it when people necessarily want to be labeled with something and not really seek the solutions for it. You know, for those that I have counseled that really have a genuine ADHD concern, it is horror. It is incredibly distressing. Using it as something to kind of say, well, you know, that must be what it is, therefore I can't do anything, is not really the proper use of the diagnosis. The proper use of the diagnosis is to guide treatment, always. In some other videos, I talk about some things you can do to help treat inattention. Now, why do I have to get a diagnosis before I can get help with it, like with a psychostimulant? It's because these things can be abused. And obviously, if your attentional circuits aren't operating at optimal level and instead they're down here, then the psychostimulants can bring them up to where they need to be. But if they're already here and then you take it, now you're going to be up here. And if you're there too long, you can start to burn out those circuits. So you really want to try and keep them as stable as possible. That's why you have to get a diagnosis before you can get a psychostimulant.